welcome to our channel today. So today's topic is congestive heart failure. In this presentation, we will cover the pathogenesis, complications, and other signs and symptoms due to congestive heart failure. So in our body, cells are working day and night relentlessly. For their work, they need dietary supplements like glucose, oxygen, and other vital nutrients. These ingredients are supplied through the blood, and blood is circulated and distributed by our heart, that we know. But sometimes heart fails to do its work. Technically, heart failure is a clinico-pathological condition in which heart cannot pump enough blood to meet the metabolic requirements of peripheral tissue of our body. So that is a technical definition which I can say. If we see, there is a term called congestive. This term is often associated with heart failure conditions. This is because in chronic heart failure conditions, in our body, in our several body parts, the fluid is built up, so body become congested, and due to this, due to the congested body, several complications occurs, which we will see later in this presentation. So what are the causes of heart failure? These are the some general causes which can lead to heart failure. Actually, maximum cardiovascular disease ends up with congestive heart failure. Let's see how these conditions actually leads to the heart failure. The ischemic heart disease, how do you know? The oxygen demand and supply is imbalanced, myocarditis, inflammation in myocardial cell, arrhythmia, valvular disease. Here is some disease called mitral stenosis. In these conditions, mitral valve become so narrow that that blood cannot flow through it. Okay. Some aortic stenosis. This is pathological condition of aortic valve, in which aortic valve become narrow, so blood cannot pass through this valve. And there are mitral valve regurgitation. In this condition, valve does not close properly, so that blood can flow backward, and it can collect in the atrium. So these are the some technical terms which should be remembered when we discuss about valvular disease. Okay, there are some other disease, severe anemia, thyrotoxicosis. Okay, let's see how these conditions eventually leads to the cardiac heart failure. So let's take an example of a patient who developed ischemic heart disease. In this condition, so we know that oxygen demand and supply is imbalanced, and myocardial cells become sick. If myocardial cells are not healthy, they become weaker. So myocardium wall become weaker, and weak myocardial wall cannot contract so efficiently that it can generate a efficient stroke volume. So so force of contraction will be down, eventually stroke volume and cardiac output will be down, so that leads to heart failure. So next take another scenario where patient develop the mitral valve regurgitation. Okay, mitral valve regurgitation, I have said before that it is not in this condition, valve is not closing properly. So in this case, blood volume in the ventricle will be so high that myocytes will go to the myocardial cell remodeling, which is basically a volume overloaded hypertrophy. It is a muscle muscular hypertrophy. In this case, in this volume overloaded hypertrophy, these cells have a very special features. The cells become elongated and thicken. Cells become elongated and thicken. If cells are elongated, then ventricular dilatation will be occurred. Means the radius of the ventricle will be increased. If the radius of ventricle increase, then the contractile force will be down, because dilatation ventricle cannot contract so well that it will generate a proper stroke volume. So eventually again the heart will go into failure. Right. Next, third scenario. Suppose a patient developed a systemic hypertension. In this case, the TPR will be increased. The TPR will be so much that the ventricular pressure, the chamber pressure will be overloaded. If the pressure is overloaded, again the myocardial hypertrophy will be take place. In this case, in pressure overloaded myocardial remodeling or myocardial hypertrophy, the cell will only be thickened. But the blood supply to the or capillary supply to the myocardial cell will be remain same. If the blood supply remains same but cell is hypertrophied or cell is thicker, then there will be again oxygen and nutrient demand and supply imbalance. Demand will be high but supply is less. Again it will develop a ischemic type heart disease, in which myocardial infarction will be occurred and force of contraction will be again go down, which leads to eventually we know that heart failure. Okay, so these are the complications in congestive heart failure. If a congestive heart failure patient, if a patient have a congestive heart failure, then this type of complication will be occurred. Suppose a patient develop the left ventricular failure, LVF, left ventricular failure. If left ventricle is failed, then it will directly affect the pulmonary circulation. In this case, in the pulmonary circulation, the capillaries are so thin that it cannot withstand the high pressure of the fluid. Here will be hydrostatic pressure will be so high that these capillaries will not withstand that pressure. So fluid will be eventually oozing out. They will accumulate in pulmonary system. It eventually leads to the alveolar edema and alveolar edema, bronchial edema. Bronchial edema, if bronchi is edematous, then there will be some secretion in bronchial tract which can cause the dry cough. And one more thing, if fluid is accumulate in this pulmonary system, the patient can feel the difficulty in breathing, and there will be problem in gaseous exchange in this particular area. If gaseous exchange is impaired, then oxygen level in the blood will be down, so hypoxia condition can be developed. Then go to the right ventricle. Eventually, if the left ventricle is failed, it will lead to failure of right ventricle. Then both ventricle will be failed. If both ventricle will be failed, again the superior vena cava and inferior vena cava, the pressure will be so high that fluid will be accumulate in various part of our body, like in the ankle, which is called ankle edema. If fluid is accumulated in ankle, that is called ankle edema. There is some other problem like hepatomegaly, which will enlarge the liver, and splenomegaly, enlargement of the spleen. if fluid is accumulate in GIT, the absorption process will be impaired. If absorption process is impaired, then patient may experience a malnutrition or nausea, vomiting. This type of complications will occur. Okay, next is signs and symptoms. This is again breathing problem, which I have I've already told that due to pulmonary congestion, this breathing problem will be occur, and this is technically termed as, or medically termed as, dyspnea, apnea, orthopnea, and again hepatomegaly, splenomegaly, the enlargement of these two organ. Okay, these are the some other signs and symptoms: dizziness, sudden weight gain due to fluid accumulation in body. Okay, that's it, and it is at last I can say that congestive heart failure is manageable with proper treatment, and many people with congestive heart failure living life productively and living a long life. Thank you.